SI node is called the pacemaker of heart. Normal heart rate generated by SI node is 60 to 100 beat per minute. Bundle of His intrinsic rate is 20 to 40 beat per minute. AV node intrinsic rate is 40 to 60 beat per minute. Purkinje fiber intrinsic rate is 20 to 40 beat per minute. Cardiac output is stroke volume into heart rate. Normal cardiac output is 5 to 6 liter per minute. Stroke volume is 70 ml average. Coronary blood flow is maximum during diastole. Heart receives blood supply during diastole. Left anterior descending artery supplies anterior wall of left ventricle. Right coronary artery supplies SI node in majority of people. Troponin I and T are most specific markers of MI. CKMB rises within 4 to 6 hours after MI. ST elevation on ECG indicates myocardial infarction. ST depression or T-wave inversion indicates ischemia. Echocardiography is the investigation of choice in valvular disease. BNP, anti-proBNP are markers of heart failure. Holter monitoring is continuous 24 to 48 hours ECG monitoring. Exercise tolerance test or treadmill test is contraindicated in unstable angina. Swan-Ganz catheter is used to measure pulmonary artery pressure. Ankle brachial index less than 0.9 indicates peripheral arterial disease. Most common cause of MI is atherosclerosis. Most common site of MI is LADA, left anterior descending artery, which is known as widow artery. Classic MI pain, severe retrosternal pain radiating to left arm or jaw. Gold standard diagnosis of MI, cardiac troponins. Silent MI, common in diabetes. Thrombolytic window for MI is within 6 hours best. Streptokinase contraindicated in previous streptococcal infection. Morphine is given for pain relief in MI. Aspirin is the first drug in MI management. MONA, morphine, oxygen nitrates, and aspirin is the treatment of MI. Left-sided heart failure involves pulmonary edema, dyspnea, orthopnea. Right-sided heart failure involves pedal edema, hepatomegaly, ascites. S3 gallop is left ventricular failure. S4 gallop, stiff ventricle or hypertension. Digoxin increases contractility, is a positive inotrope. Digoxin toxicity signs are nausea, vomiting, visual changes, yellow vision. Antidote for digoxin toxicity is digoxin immune fab या Digibind. BNP more than 100 pg per ml suggests heart failure. NYHA classification is for heart failure. Pulmonary edema best managed with furosemide. Most common valvular heart disease in India is mitral stenosis. Opening snap murmur is heard in mitral stenosis. Most common cause of mitral stenosis is rheumatic heart disease. Mitral regurgitation, tense systolic murmur at apex radiating to axilla. Aortic stenosis, ejection systolic murmur at aortic area radiating. Aortic regurgitation, early diastolic murmur at left sternal border. Kerry-Coombs murmur is heard in mitral valvulitis in acute rheumatic fever. Graham-Steele murmur is heard in pulmonary regurgitation. Prosthetic valves require lifelong anticoagulation. Mitral valve is most commonly affected in rheumatic heart disease. Rheumatic fever caused by group A beta hemolytic bacteria. Jones criteria used for diagnosis of rheumatic fever. ASCOF bodies is a hallmark of RHD. Erythema marginatum, specific lesion of rheumatic heart disease. Penicillin prophylaxis is essential in RHD. Hypertension, BP more than 140 by 90 mm of Hg. Malignant hypertension, diastolic BP more than 120 mm of Hg. First line drug for hypertension, thiazide diuretics. In diabetes, first line antihypertensive is ACE inhibitors. Hypertensive emergency, DOC is IV sodium nitroprusside, labetalol. Shock, inadequate tissue perfusion. hypovolemic shock due to decreased preload, cardiogenic shock due to pump failure. Septic shock involves warm shock with bounding pulse. Anaphylactic shock treated with IM adrenaline. Distributic shock involves septic, anaphylactic, and neurogenic shock. First sign of shock is tachycardia. Most reliable parameter in shock is urine output. Normal urine output is 0.5 to 1 ml per kg per hour. Crystalloids are first choice in hypovolemic shock. Atrial fibrillation, irregular pulse plus risk of stroke. Give anticoagulants. Ventricular fibrillation, most fatal arrhythmia, most common cause of sudden cardiac death. ECG of ventricular fibrillation. Chaotic, irregular waves, no identifiable PQRS or T wave. First treatment of ventricular fibrillation. Immediate defibrillation, asystole treatment. CPR plus adrenaline. Defibrillation not useful. Supraventricular tachycardia. Treatment. Valsalva maneuver plus IV adenosine. Amiodarone, drug of choice for ventricular tachycardia. Torsades de Pointes, treated with IV magnesium sulfate. Heart block, best managed with pacemaker. Intermittent claudication, hallmark of peripheral artery disease. Burzer's disease, strongly associated with smoking. Raynaud's disease, episodic vasospasm of extremities. DVT, diagnosed by Doppler ultrasound. Versostriid, stasis, hypercoagulability, and endothelial injury. Pulmonary embolism, classical symptom is sudden dyspnea. Hohmann's sign, calf pain on dorsiflexion. DVT. Holter monitor, useful in paroxysmal arrhythmias. Greenfield filter, prevents pulmonary embolism. Heparin antidote is protamine sulfate. Warfarin antidote is vitamin K. First heart sound S1. Closure of mitral and tricuspid valve. Second heart sound S2. Closure of aortic and pulmonary valve. Pericardial tamponade triad. Hypotension, muffled heart sound, and JVP increased. Pulsus paradoxus seen in cardiac tamponade, cardioversion. Synchronized shock. Defibrillation, unsynchronized shock. Position in cardiogenic shock. Semi-Fowler's position reduced preload. Position in hypovolemic shock. Supine with legs elevated. In MI, oxygen given only if SpO2 is less than 90%. तो दोस्तों ये थे कार्डियोवैस्कुलर सिस्टम के 100 वन लाइनर्स। अगर आपको ये वीडियो पसंद आया तो लाइक करना और सब्सक्राइब करना ना भूलें। नेक्स्ट एपिसोड में हम बात करेंगे मेंटल हेल्थ नर्सिंग के 100 वन लाइनर्स के बारे में। कीप स्टडिंग एंड बेस्ट ऑफ लक फॉर नॉर्सेट।